morning, welcome back colleagues again to module 7 of infection prevention and control. I think after listening the module 6 for contact precautions, standard precautions, I think now the next module is we are going to talk and discuss about the transmission based precaution. As all of you know, I am Dr. Mustafa, clinical microbiologist from Care Hospital, Nampally. And this module we are going to discuss in detail about the transmission based precautions. If you remember, before we start in the proper topic of this module, if you remember in the previous module we discussed more about the standard precautions, what we are all going to take. As I said in my previous module, again I am repeating before we go into this topic that standard precautions are mandatory for all the patients irrespective of the diagnosis. You should not wait for the diagnosis to come and then to follow the standard precautions. It is mandatory for all the patients who are coming to the healthcare industry. The difference between the standard precautions and the transmission based precautions are that taken after you come to know that the patient is suffering from particular disease, or if you have a strong clinical suspicion that the patient is suffering from droplet or airborne diseases. Coming to the first thing, the transmission based precautions are of the patients who are known or suspected to be infected or colonized with infectious agents, including certain epidemiologically important pathogens, and are used when the routes of transmission are not completely interrupted using standard precautions. That means, wherever you are applying the transmission based precautions, it does not mean that the standard precautions are not needed to be followed in these patients. It means that the standard precaution plus you are going to follow the transmission based precautions, and the transmission based precautions are indicated in those cases where you feel that taking only a standard precautions will not serve or will not protect the healthcare worker or a patient from the diseases. So, this is, if you ask me, it is a step ahead of how to do the infection prevention and control in the cases where you need to have an extra cover apart from what you had in standard precautions. Coming to this, the TB after knowing the infection and the colonization status, if you see here, when we know the status, the reservoir, we can take a proper precautions, and when we know the mode of transmission, the more better precautions we can take. So, in this slide if you see, if you know the type of disease and if you know the status of the reservoir, suppose the reservoir which I am having is a waterborne or it is airborne or droplet, then you can take precautions accordingly. And at the same time, when we know the mode of transmission, like how it is going to get transferred, then you can take appropriate standard precautions and airborne precautions. Coming to the transmission based precautions, it is implemented when the routes of transmission is not completely interrupted using standard precautions alone. As I said just now, in standard precautions, as all of us know, we have a personal protective equipment and patient placement or cohorting. Sometimes we need to cohort the patient where there is chances where the patient can transfer infection to other patients, then we need to cohort and limiting the patient improvement and the engineering control. If you ask me, this engineering control itself, it is a very big chapter in infection control, where you need to have a proper engineering control in high risk areas in the hospital. High risk areas in the sense, I mean the operation theatres, intensive care units and CSSD and ICUs and even the pulmonology OPDs, where you infectious disease OPDs, where you deal with the infectious diseases agents and all. So, engineering control plays a very important role in not only preventing the infections from getting spread, but also it helps in localizing the infections at the particular place and avoiding it to get spread to other places. So, that is where the engineering control plays a very important role here.